everybody. Welcome back to Nurse Table Talk. Julie and I are finishing our trifecta, as we call it, on the basics of dementia. So in video number 1, we talked about what is dementia, what does it look like, what you should do if you think you or a loved one has it, who you should see, that kind of thing. In video number 2, we talked about the caregiver's 10 commandments, which is 10 kind of guidelines that we encourage caregivers to use so that they don't go crazy. And today we're going to wrap up with caregiver burnout, stress, or syndrome, whichever you like to call it, because video 2 is exhausting. You're patient, you're kind, you're reassuring all day, all night, over and over and over again. And so there comes a point where you're just like, I need help. I don't know why I feel like this, but somebody better help me.
Yeah,
So
totally.
we're going to talk about that because that's real. So Julie, do you want to kind of start and sort of like give ideas of what those symptoms look like and
Sure.
who suffers from this?
Sure. So to let everybody know, if you have these symptoms, you're not alone. This is really kind of across all persons and everywhere. So, and it actually about 1 in 3 people actually take care of a loved one informally. They're, maybe at home, or they call their loved one or whatever they do. But 1 in 3 people is pretty popular. So
a lot of people.
Yeah, so just remember you're not alone. But like feeling overwhelmed could be one of those symptoms. You're, like Kathy said, there's just so many things you're trying to work. There's just tons of things that you have on your mind in addition to caring for your loved ones. So that's a normal feeling.
Being tired, like feeling like you're getting enough sleep and being like completely exhausted by 11 is sort of a sign that you're burning the candle at every single end. So, and being worried, like laying down to go to bed and have all of those racing thoughts and, silly things, important things, dumb things, but you're still not sleeping. That's another sign that you could be completely overwhelmed with this.
Right.
Yeah.
And having a sense of guilt too. I mean, I know many people that have experienced guilt. You feel like you're not doing enough and you should, woulda, coulda, shoulda, and you're just, it's always there. You can't get rid of it. So that's another symptom.
And not wanting to be around other people. I mean, I know now we're in the middle of COVID, but you're taking care of your loved one, and that's your only social outlet, and you're not around anybody normal. You're not talking to anybody who's not sick. You're not taking care of yourself. You're not doing any of those things for yourself that really like feeds you, because you're giving it all away. That's another sensation and another feeling where you could be heading down that road of just, feeling kind of burned out and kind of tired of it all.
Right. And so dealing with that, many people may reach for that glass of wine or alcohol that they normally wouldn't do, or, they might have prescription drugs that they're reaching to, or some kind of,
or you're using food, or you're using
any kind of comfort.
Yeah, you're binge watching stupid crap at 4 o'clock in the morning instead of sleeping. Any of those things is like, those are not good coping skills, but if you do it, it makes you human like the rest of us. So
right.
Do not be ashamed that you can't figure out how to be 18 people at one time, because we've all had that experience where we feel like we should be able to do more. What is our problem?
Right.
So, so I think what is at the core of this, which I think is so cool, and Julie had this in her notes and just hit me like a lightning bolt, but at the core of this is that you have no control. And I don't think people realize that we as human beings, how much that means to us to be able to have a sense of control in our own lives. Right. So when you're taking care of somebody, whether they are 2 or they are 82, it's the same feeling. It's, I want my life back. I want to be able to go to the bathroom by myself. I want to be able to not always have to think about somebody else. You want a little bit of control back. So Julie made a great list of ways to do that. So Julie, why don't you share that?
So taking back control, let's start off by setting some boundaries. Focus on what you can do and not what you're not getting to. So that's really important, Delegate. Delegate's a big one. Giving up, what I've seen in my past work history is people think that nobody can take care of their loved one the way that they take care of them. And that's true. Nobody knows them as well as you do. But you have to relinquish some of that so that you stay sane and get some extra support. So ask for help.
Ask for help. I always tell people there is just as much grace in being able to receive help as there is being able to give help. If you've got people in your life who are constantly asking you, Julie, can I bring you a meal? Julie, can I pick that up at the store for you? Julie, can you want to take a walk after work? Julie, let me come over on Saturday and clean your bathrooms. Julie, if you've got people in your life that are offering and you have like this big hat that, you're not going to say yes, and you ought to be able to figure it out on your own, you're kind of taking that joy away from them too.
You want to say yes, yes, and yes.
Yeah. Stop saying no to the offers for help. And it might, when we were doing our case management work, my line to everybody was like, if someone offers you something and you don't even think you need it, say yes anyway, because just to know that there are people in your corner that care about you, that want the best for you, that are nervous or worried about you, that are seeing what you're putting yourself through. Sometimes it just feels like a good big hug, and it's enough to sustain you through another day or two. So That's really important. Let people help. Sure. And then there's professional resources, right, Julie?
Right. And again, we have a resource as a social worker, and you can call your providers, your doctor's office, your specialist, and let them know what's going on and ask them if they have some recommendations. But we do have a video on how social workers can help. So maybe review that when you get a chance, and don't hesitate to reach out.
Yeah, case management is another thing that we've covered in our series, and it's another avenue for some real-time, good perspective, well-grounded, educated help, somebody to help you get linked into, community-based resources to sort of alleviate the burden. But at the end of the day, what we really, really want you all to take away is, like Julie said, 1 in 3 people in this country do this, and it's thankless work.
And you're not alone.
And you're not alone. And so don't sit back and suffer and just exist. You deserve to be happy too. You deserve to have your own time too. You deserve to go to the bathroom by yourself too. And so if you're not getting your needs met, you're probably not that robust, happy to be helping person that you really honestly started out as. So yeah. And I will say this, just personal experience, and Julie mentioned guilt, which is completely real, is that you do it for as long as you can. And when you can't do it anymore, it's okay. It's okay. No one's judging you. You have to know that you can only do it for a limited time. It's how it works. So right. I hope that helps.
It's absolutely. And after watching our series and today's video, hopefully you have become more informed and will be able to reach out to your doctors, specialists, nurse case managers, social workers, whoever you have, that you're able to talk to. Don't give them a call. Don't hesitate just reach out. Yeah. And so thanks for watching us today.
Like the content you just watched? Hit the like button or hit subscribe here. If you want to be notified of any future videos, please ring that bell. If there's any topic you'd like to see discussed, leave us a comment in the comment section. Nurse Table Talk. Save time, save money, be informed. Thanks for watching.